Hey everyone, my name is Lindsay Wheeler and I'm going to be going over equine vices. I'm going to explain some of the common ones that you might come across and their causes and treatments. Vices are stereotypic behaviors or bad habits that are repeated without any apparent purpose. They occur in 10 to 20% of domesticated horses and can cause physical or psychological harm to the horse. Different vices have different causes, but they all tend to occur as a result of environmental stimuli like housing conditions, social contact, and boredom. The first vice I'm going to talk about is cribbing, also known as crib biting and wind sucking. This is one of the more common equine vices that you might come across. The horse will anchor their incisors on an edge, arch their neck, and then begin gulping air. The cause is unknown, but it is theorized that the behavior releases endorphins, which stimulate the pleasure center of the brain. The horse becomes addicted to the endorphins, and they likely just discover this behavior out of boredom or stress. Cribbing may increase colic risk, cause damage to teeth and stalls, and damage muscles in the neck, mouth, and jaw. Cribbing is incurable, but it can be helped with a variety of treatments. One common treatment is a cribbing collar, which helps prevent the contraction of the neck muscles. In some cases, a muzzle can be used to help as well. One other option is crib halt. Crib halt is a spray that can be applied to surfaces to give them an unpleasant taste. This slide pictures a muzzle on the left and several different cribbing collars on the right. And next there will be a quick video with an example of cribbing. Another common vice that you might come across is weaving. Weaving is when a horse sways back and forth, often in front of a stall door or gate. It's caused by confinement, boredom, stress, separation anxiety, or feeding time. Weaving is also believed to be a learned behavior, which means other horses in the barn might start doing it as well. Weaving can cause damage to hooves and weight loss, so it's important to treat. Although it can't be cured, it can be managed in a variety of ways. You can allow opportunities for physical exercise, provide companion animals, or install mirrors at eye level for visual stimulation. Other common practices to help weaving include turning out horses where they can see other horses, or installing doors that allow them to stick their heads out. Next, I'll provide a short clip of a horse weaving. The next vice I'm going to talk about is wood chewing, also known as lignophagia. It's the gnawing of wooden fences, rails, or boards. It may start out as a dietary deficiency or out of boredom, but if it is not treated early, the horse may form a habit and it'll be much harder to get them to stop. Wood chewing is particularly dangerous because of the wood splinters that are ingested and their potential to cause colic and other gastrointestinal issues. There is a risk of gum damage from splinters, and long-term wood chewing can result in tooth deterioration. Horses that crib may also begin wood chewing. Wood chewing is very treatable, especially if you catch it early. Some possible treatments for wood chewing are dietary supplements like quit. You can also increase a horse's roughage or use sprays like crib halt and chew stop to make the wood taste unpleasurable. Some people also suggest using toys to help stimulate the horse's oral fixation. On the next slide, there will be a video example of a horse wood chewing. Another vice to know is pawing. A lot of horses may paw occasionally, but it's considered a vice when it occurs frequently and repeatedly. Pawing may occur as a result of confinement, boredom, stress, or frustration in waiting for food. Horses who paw may dig holes, tip over feeders and waterers, and get their legs caught in fences. Horses may also wear out their hooves and lose shoes. Pawing is manageable in a variety of ways. You can provide more exercise, use rubber mats to avoid damaging the floors, avoid reinforcement by giving food and attention during pawing episodes, or use pawing bracelets, which make pawing uncomfortable. Next, I've got a quick video of pawing. Okay, so next we are going to talk about self-mutilation. There are three main types of self-mutilation. The first is self-mutilation due to physical pain. The second is self-directed intermale aggression. And the third is a seemingly functionless nipping at various parts of the body, which is the one that's considered a vice and the one that I'll be talking about. So self-mutilation as a vice is just this quiet, rhythmic, repetitive nipping at various parts of the body, often the flanks, and it is believed to release endorphins, and it may start as a result of physical pain, but become a habit that lingers once the pain is resolved. Other theories suggest that it's triggered by confinement, lack of exercise, or maybe sexual frustration. Self-mutilation is much more common in stallions than mares or geldings. It is manageable. The first step is to rule out any possible physical problems that may be causing the horse to display this behavior. After that, you can look at other things like providing more exercise opportunities so they don't feel as confined, or they can release some energy. Possibly having companion animals or toys for other stimulation. One other option is an equine neck cradle, which is pictured on the bottom right of the screen. The neck cradle was designed to prevent horses from tearing their blankets and sheets, but it can be an effective treatment. It'll prevent the horse from bending their neck to their sides, so that can be helpful, or possibly a muzzle. And there are also possible future pharmacological treatments. I could not find a good video for this one, so I'm just going to move on to the next vice. The final vices that I'm going to talk about are stall walking and fence walking. These two vices are essentially the same. It involves rapid walking or pacing, either inside a stall or around the edge of a fence. These often occur because of anticipation of a meal, a need for companionship, or maybe the horse just needs more exercise or stimulation. These can be managed in some horses. It can be helpful to give them toys so they can stimulate themselves, increase turnout time so they don't feel as stuck inside, or maybe companionship. You can get them a companion animal of some sort. Next, there's going to be a video of a horse stall walking.